Hey, my name's Temple.
And I'm Hannah, and we're students in the dental hygiene program at Cape Fear Community College. We're going to review some adjuncts with you today, and we're going to get started.
So first we have a manual toothbrush. So with a manual toothbrush, we always want to make sure that we're using a soft or extra soft bristle brush. Using a medium or a hard bristle brush could cause some abrasion, and then we will also want to make sure that we change the brush every 3 to 6 months.
And then another option would be an electric toothbrush, like a Sonicare and Oral-B. These are good because they are more effective than a manual toothbrush because they can do more strokes in the same amount of time. You can use the same base with different heads if you and somebody else wanted to use the same one, but you also want to make sure you're changing your head every 3 to 6 months.
And then next we have sensitive toothpaste. So we have many different brands. Sensodyne is one that's really popular for sensitive toothpaste, but Colgate and Crest also make sensitive type of toothpaste. And people who would benefit from using this are people who have sensitivity to hot, cold, sweets, acid, or contact.
And then another good toothpaste that we recommend in our clinic is Gum Detoxify. So it's actually an anti-cavity and an anti-gingivitis toothpaste. So what that means is it helps prevent cavities as well as reducing the amount of bacteria that's present in your mouth to help your gums heal and process everything that you're putting in your mouth, either food or drink-wise. We also want to review some whitening toothpaste. So if you have sensitive teeth, you don't want to use a whitening toothpaste. A lot of people want to get a toothpaste that's whitening just because they do want whiter teeth. A good example would be the Crest 3D White. And then we also have a two-step, which is the Crest HD, which is you use this first and then this one to follow. They are good if you want to use them, but if you really want to whiten your teeth, I would talk to your dentist about that.
And then next we're going to talk about flossing. So the most effective way to floss is just regular floss. And we're going to pull 18 to 20 inches of floss out and then making sure we make a C shape around the tooth. So we're going to go between the teeth and then make that C shape and go under those gums and then make a C shape the opposite way and go under those gums. And we always want to wrap it on our middle fingers and then use our thumb and index finger to make an up and down motion to go between the teeth, making sure not to pop the gums.
And then, so if you aren't very good at using regular string floss or just don't really have the time, we always recommend string floss, but we also use these as well. They're called plackers. So they look like this. You can get them anywhere you can buy regular floss, a dollar store, a pharmacy, any grocery store. So these are good because you can go through your teeth. You can put them in the car and do them on the way to work or the way home from work, but they're not as effective as string floss, but if they're a lot better than nothing. They also come in a kid's version, which this one has a little animal on it. It's orange, and it actually has different flavors. These are berry flavored. Same thing, you can get them pretty much any grocery store, Dollar Tree, CVS.
And then next we have a water pick. So there's two different types of water picks. There's some that you can use in the shower, and then some that you just sit on the counter and use with your morning routine or your night routine. What it does is it pushes water through the teeth to remove the bacteria. And it's not as effective as string floss, but once again, it's better than nothing.
And then lastly, for like flossing aids, we have what are called gentle picks. So they're just like a toothpick, except they're rubber. They have little prongs on the side that are rubber. They're not abrasive at all. And they're good for if you have like a wide contact area where you like pack food and everything. You can reuse them if you need to. This one actually comes in a little carrying case and everything. So this would be a better option. Like I said, if you have a really open space, you can use it after meals and everything to clean it out.
And then next we have a tongue scraper. So tongue scrapers can come in many different types. There's many different looks to them. Using a back to front motion, so we'd start at the back of the tongue and then scrape forward and then clean off the tongue scraper. And we would just want to make sure we rinse it off after each use. And then you'll be done whenever you think your tongue is clean or whenever it looks clean. And then after you're completely done with the tongue scraper, we want to rinse with some water. And what this does is helps prevent bad breath because it gets all that bacteria off the tongue.
And so lastly, we're going to talk about some mouthwashes. First, we're going to talk about some mouthwash for xerostomia, which is dry mouth. We always want a moisturizing mouthwash if you have dry mouth. There's Biotene and the one we just showed. There's a bunch of different brands. Just as long as it says moisturizing, that's a very good option. You always want to look for fluoride in your mouthwash if you're looking for one, especially for xerostomia, because you don't want to cause it. You want your mouthwash to have fluoride in it to help prevent cavities. And then a regular mouthwash just for anybody for a regular day would be like Listerine, Total Care. You want to avoid alcohol because it has some harmful effects on the oral cavity. It reduces the amount of saliva present. It can cause a burning sensation and kills all the bad bacteria that's present in your mouth when we want to keep the good bacteria that's present. We want to make sure to use our mouthwash at night so that it sits on our teeth while we're sleeping, and that's just make sure it has some fluoride.